Hello, and welcome to the Alabama Public Health Training Network. I'm Carolyn Miller, Social Work Director for the Bureau of Family Health Services at the Alabama Department of Public Health. Thank you for joining us today for our program, Alabama Early Head Start Child Care Partnership Grant, Care Coordination Program Update. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for social workers for this program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheets and evaluation. While content may continue to be relevant, CE credit will only be awarded for 2 years for social workers, expiring on June 30th, 2021. If you are watching this program on demand and want to receive a social work CE certificate, you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. For social workers, if you are watching this program live, it qualifies for classroom hours. If you are watching on demand, it is considered non-classroom hours. For care coordinators working in the Early Head Start program, you must complete and pass the test in LCMS that is included in the packet of information regarding this program as part of your required training. Before we get started, I would like to introduce our presenter today, Melissa Godwin, Coordinator of the Alabama DHR Early Head Start Grant at the Alabama Department of Public Health. Welcome, Melissa. I know we have a lot of important information to cover today, so let's go ahead and get started.
Thank you so much, Carolyn. I'm just glad that everyone is able to view this presentation today, and I would also like to just mention that we also have folks from the Reach Out and Read program who are viewing this presentation as well, who are partnering with us to help with this grant. Today, the objective of the presentation is to refresh the staff on protocols and procedures when providing care coordination services to referred Early Head Start children and educate the staff about additional services to provide the Early Head Start providers and the parents of the EHS children. The Alabama Department of Human Resources Early Head Start Child Care Partnership Grant is between the Alabama Department of Human Resources, Alabama Department of Public Health, and the Early Head Start Child Care Partnership Program, which began in 2015. Currently, the grant allows for up to 566 children to receive care coordination services. On average, an enrolled Early Head Start child can receive up to 10 hours of care coordination services during the program year. I would like to mention that that number, even though we are saying 10 hours, that number is somewhat fluid because not every child requires or will need the full 10 hours. So we're able to move that around so other children can receive additional services should one child not need the full 10. Establishing partnerships between Head Start programs and licensed child care centers and a statewide family child care hub. There are partnerships with the Alabama Department of Children Affairs, the Alabama Department of Public Health, Auburn University, and the Alabama Department of Post-Secondary Member Schools. The purpose of the grant, this program serves eligible children already receiving child care subsidies and the priority need teen mothers and families challenged by child abuse and neglect issues and homelessness. This is a statewide effort that includes urban and rural counties where there is a high number of children experiencing poverty. It provides early learning and links to the children and helps link them to preventative medical and dental care that's needed and helps to prepare the child to enter the public school system. It's a statewide collaborative effort, as I've mentioned. Counties that have one or more Head Start Center sites participating in the DHR grant and refer children for care coordination services include Butler, Cherokee, Crenshaw, DeKalb, Fayette, Houston, Jefferson, Limestone, Madison, Marshall, Mobile, Randolph, Talladega, and Tuscaloosa. Counties with family daycare homes, which are under the umbrella of Auburn University Department of Human Development and Family Studies, that provide EHSCCP services through the grant, include Autauga, Baldwin, Conecuh, Coosa, Coleman, DeKalb, Elmore, Franklin, Hale, Lowndes, Madison, Pike, Mobile, Montgomery, Morgan, St. Clair, Talladega, and Tallapoosa. I would like to mention, I've listed these counties out for everyone, but DHR has released, or they have announced the new RFP, and there may be some changes, and we may see some different sites that are not in this list at this point in time. I want to talk a little bit about the role of the care coordinator. The role is to assess the child's needs for a medical home, assist in linking the child to a medical home if needed, educate the parent and caregiver about well-child appointments and the importance of preventative care. Roles also include, for children who are insured by Medicaid or appear Medicaid eligible, educate the parent about the EPSDT screenings and the purpose of the screenings. You want to monitor compliance with well-child appointments and EPSDT appointments with the primary medical provider. Roles also include assessing the child's needs for a dental home, educate the parent or the caregiver about the importance of a dental home by 12 months of age. I will just mention that this is one of those places where I think across the nation, but particularly here in Alabama, we are falling short. And we need to really focus on educating these parents about the importance of accessing a dental provider by the 12 months of age. So just if you want to file that away, and just keep that in mind, because as we move further, we've included some materials that I think will help us to meet the mark a little bit better in regard to educating our parents. We want to educate and assist the parent and the caregiver in locating a dental home for the child, and we want to monitor compliance with dental appointments.
Melissa, why is it so important to have a dental home at such an early age?
Well, there are so many connections between oral care and your physical health, and we want to make sure the doctors and the dentists want to make sure that children are receiving the care that they need and trying to prevent any health issues from occurring. So that's one of the main reasons, or some of the reasons why. When I say 12 months, or when we list that, that is recommended by the American Academy of Pediatrics, and that's where we receive our guidance from. The role of the care coordinator. We want to assess if the child or the family may have any other needs, and we want to link the family to the needed resources. For example, you can see here, there's information about WIC, and one of the things that I'm not sure if you're aware, many of you probably are, WIC now has a new app that's out, and so when you're talking with parents about different benefits like WIC, you know, if they're eligible, they may not want to come in and apply, but now they have an electronic way that you can apply for the benefit, which I think for people who are so busy, we're all busy. And, you know, I just think it's a great opportunity for folks to be able to take advantage of some benefits that they're entitled to. Food bank is another obvious one that, you know, we link our families to. Sometimes, you know, when we work cases, not only do we work the child, we're also working the family system, because that's what social work is about, is working the family system. So you may, in talking to the family, you may find out that mom or dad doesn't have health insurance and they can't afford to purchase their medications. Well, this is a great opportunity for you to be able to link the parents to needed services, because in the long run, the parent having the medication, of course, helps the child and helps to keep that family system stable. Transportation is another area that across the state, I know it always comes up that transportation is an issue, and so that's another job that the care coordinator has, is to educate about transportation services that are available in your individual community. Now I want to talk a little bit about required documentation. The required documentation includes the electronic referral form, the psychosocial assessment, the progress note, the case plan, report to referring provider, the SSR, which is our billing form, and then the CHR 6A. You will find example forms in the information that you've received from our office. In your notebook, you will find that information, just some different example forms that may help you. I want to talk a little bit about the electronic referral form in ACORN, and you'll see an asterisk throughout these slides, and that indicates a protocol change. And to just FYI, sometimes if you see a protocol change, you see an asterisk, that might be very helpful for you to remember when you're taking a test. So to just give you a heads up on that. The electronic referral form. It's very important that you always select the correct program, which you want to select DHR, Early Head Start. I think we get so used to going in ACORN and checking and just doing it so quickly. And what I found is that what happens is you're checking, some people will check patient first or select patient first as the program just simply out of habit. But you just really want to make sure that you're selecting the DHR Early Head Start, because that's all connected to billing, as well as the referral, the report to referring provider form. The referral needs to be entered within 5 days of receiving the referral. And you see there's an asterisk by that. This is a new step in the protocol. You just want to make sure that the referral is entered within 5 days of receiving the protocol, of receiving the referral. You complete the referral form in ACORN one time per school calendar year. I've talked to several managers about this, and just to try to get an idea what is the easiest way for staff to remember about completing that new referral form. And managers all told me different ways. So I can just tell you what I would do, and maybe talk with your manager, and y'all come up with a system. This is with Early Head Start, they work on school year. And so in my world, I see that every year per school calendar year, I'm going to do a new referral. And so August is when school starts, so that's when I'm going to do that new referral form every year. You want to complete each tab on the electronic referral form. The referral source, you're going to select DHR, Early Head Start. Again, it's very important that you select on the referral source DHR, Early Head Start. That is because it's tied to the report to referring provider. And here's just an example. Everyone, all the staff have seen this form in ACORN. You want to go in, and you'll see where I've selected DHR, Early Head Start, in the program above in the top section. And then the referral date, it needs to be within 5 days. And then you would put the other information in. Referring provider. Again, you're going to put in DHR Early Head Start. You don't have to fill out any other piece. If you will just put referred by DHR Early Head Start, because this information is submitted to DHR. Once you actually submit that electronic report, what I do is I run a report and I submit all of this on a spreadsheet. Nothing goes to DHR in regard to the actual report to referring provider that you complete on your particular patient. We just send it as a spreadsheet, like I said, so you want to make sure that you are choosing referred by DHR Early Head Start. The referral form, the reason tab. And your reason for referral, you're going to check DHR Early Head Start, and then you'll have a DHR EHS Daycare Center provider, and then there's a drop-down box. You're able to choose which provider. We have gone in and we've added other. One of the reasons why we added other as a possibility is because, I'm going to use Madison County, for example. About 6 or 8 months ago, I think it was, they had a site that was no longer participating in the grant. Well, they were listed, and so we didn't have, and let's say that the name of the new daycare or Early Head Start was Jack Smith's Early Head Start program. Well, we didn't have Jack Smith listed on there, and so staff were like, well, how do I do it? How do I do it? So what we've done is we've gone in and we've created you an other category, and you'll be able to just choose other. Let me encourage you, though, not to choose other unless it's just absolutely required, because we want to be able to have accurate data and provide the information to the Department of Human Resources. Now let's talk a little bit about the psychosocial assessment and the case plan, the development of the case plan. The ADPH care coordinator completes a psychosocial assessment on each child receiving care coordination services. This is not new. We do it for all of our patients, so this is, this is easy peasy, I think, as Meredith is one of those phrases Meredith uses. It's simple. This assessment covers multiple aspects of the child's family's life, including support systems, housing needs, parenting issues, any medical and dental concerns, mental health, domestic violence, substance abuse, educational needs. I really encourage you to spend some time with the family in doing this assessment so you can really paint an accurate picture of what's going on. And you are free to, anytime you learn something new about a family, to go in and pull that assessment up and edit it. But it's only required that you do the initial psychosocial assessment, and then you'll do an update at least once every 6 months. And the assessment is updated as needed and at least one additional time throughout the year. The psychosocial case plan. The case plan is developed with the parent and the caregiver. Let me repeat that. The case plan is developed with the parent and the caregiver based upon information gathered from the assessment. It's really a true partnership, and I'm hoping that as we talk a little bit further, that we're going to talk about some things and some materials that are going to be introduced that will help you with bridging that gap and helping to get the family a little bit more willing to share information. But I know every one of you is y'all are so prepared and professional that you probably don't have too much trouble getting getting families to talk about what's going on with them. The case plan is reviewed with the parent and the caregiver 6 months from the date of the initial case plan, and it's updated as needed. A new case plan is completed annually. So we're doing a referral at least once a year. We're doing our psychosocial assessment, and we're doing a case plan annually. I have created a chart that shows you, I remember a director had asked for this long ago about another program, and I thought, well, maybe I should do this because it might have been Martha Metters who had asked me about having something like this. So what I did was I actually just went in and created a list of minimum documentation requirements. If you want to print this off, or I can send it to you by Excel just so you'll have it. Your initial EHS referral is one time per calendar year. The psychosocial assessment is one time per calendar year. The psychosocial update is one time per calendar year. The case plan assessment is one time per calendar year. Case plan update is one time per calendar year. Report to referring provider is following any significant contact. I want to talk a little bit about what a significant contact is, and that is, and I'll go into a little bit more in the next slides, but I just really want to distinguish a significant contact is, it's not just making a phone call to a parent or making a phone call to a doctor's office to find out if they had a doctor's appointment. It's really making a connection with the family and getting some information that you might use on your psychosocial assessment, or some information that if you're thinking that, for example, the mother's having transportation issues or she's having to get off work and you need to help the mother work with the doctor's office about finding a time that's better for her to get her child in for an immunization, then that type of thing is considered more of a significant contact. One change that we're going to see in the report to referring provider is following each patient education session. I'm going to talk a little bit more about these patient education sessions, but that is every time you have a patient education session, then you'll want to make sure that you submit a report to referring provider, and that'll make more sense once I go into the report to referring provider. The SSR. We want to do this when billing for services. And remember, when billing for services, it's very important that, because we do want to be paid for our services, that you complete that SSR anytime there's billing that needs to be, anytime you do any activity, and then a progress note as needed. Now, let's talk a little bit about required contacts. Contact requirements. Is face-to-face contact required? Yes, it is required. Yes, yes, yes. With contact requirements, what I've done is I've broken into the EHS provider and the parent and caregiver. EHS provider contact was already required, but we are requiring that you have one face-to-face visit at the Early Head Start provider per calendar year. And we've got some ways that will help you with that, because you may be thinking, well, how am I going to do that? And what am I going to spend time with the EHS provider about? I've only got one child there at the EHS site. So I'll talk a little bit more about that and to help you use that time. We want at least one additional successful contact with the EHS provider by phone or face-to-face. The parent and caregiver. We need at least one significant phone or face-to-face contact with the child's parent or caregiver per 90 calendar days. That is not a change from the previous protocol. And we want at least 2 face-to-face contacts with the child's parent caregiver per calendar year. So 2 contacts with the parent face-to-face per calendar year. I just want to talk a little bit about reminding you about some steps to take when an initial referral is received. After receiving the initial referral, the first contact should be with the referred child's EHS provider. I'm stressing this because by nature, I think we automatically, what we've done with the Patient First program and the other referral types that we've worked, what we typically do is we'll pick up the phone and we'll try to reach the parent. It makes perfect sense that that's what we do, right? And because they're the ones who the referral is with. We're releasing it. We're going to get information. We're going to tell them about the program. But the reason that what we've had to do and what we have previously done is DHR has asked that we contact the EHS provider first. The parent has agreed to this program in advance. They are very aware of the services. They should be, anyway, the parent should be. So it is very important that you remember you want to contact the Early Head Start provider, whether it be a center or whether it be in the home setting, and you want to inform the EHS provider of which children are eligible to receive the care coordination services. Let's say I'm talking to the EHS provider on the telephone. Well, naturally, what I'm going to do is I'm going to update the child's contact information. I'm talking to Miss Susie, and she's got 5 kids in the home, and 2 of them are new referrals to me, Jack and Jill. Well, so I'm going to get Jack's parents' information. I'm going to get Jill's parents' information. I'm going to make sure that I have the correct telephone number, and because our parents do move, and so we want to make sure that we've got that correct phone number and the contact information. And that EHS provider is going to know a ton of information about this child, what his needs are, what his likes are, what his dislikes are. What are some of the stressors in the parent's life? There's going to be some great information that you can learn from the EHS provider just in that, 10-minute phone call. And working with your provider, you and your provider may figure out what's the best time for you to make contact. What's the best day for you to make contact? If you're planning on a face-to-face visit with the EHS provider, you got to do that. You've got to schedule that in advance because you can't expect the provider to step away from the children in order to meet with you. So you've got to make sure that you're scheduling those visits in advance. But if the EHS provider may want you to call during nap time, and because the kids are asleep, and then that way you could get a lot more information, and maybe the EHS provider won't feel as stressed. You want to obtain relevant information regarding the child's psychosocial needs. The second contact is with the child's parent or caregiver to discuss the care coordination program and the benefits of the program. I said just a few minutes earlier that the parents knew about this program, and they do, because when they signed up for their child to participate in this grant, not only are they getting free child care, they're getting free diapers, they're getting free food for the baby while the baby or the child, while the child is at the Early Head Start site, and they get the bonus of care coordination. So I just think it's an awesome package, and they are very aware. So you've got to figure out the best way that you're able to help that parent to see that it's a true benefit, because not every parent wants a social worker in their lives. But I'm hoping that some of the resources we're going to talk about in a few minutes, I'm hoping that some of those resources will help smoothing that transition. Contact the Early Head Start provider and the child's caregiver within 5 calendar days of receiving the referral. All right, so you got to have your electronic referral in within 5 days, and you've also got to have that contact within 5 calendar days. The current report to the referring provider. Everyone who's working these cases is very familiar the way the report is set up, and we, again, like I said earlier, we draw data from that. So this is the way it currently is. We are creating a new report to a referring provider that will actually, we're going to add a few more. It's going to look very similar to the asthma. I don't know if some of you all remember the way the asthma report to a referring provider looks, but it's going to have some similarity to that. There are going to be some specific questions on the report that are going to be added to this particular one that will address patient education topics the care coordinator discussed with the parent by phone or face-to-face. These topics are related to child health, child oral health, and child development. I'm going to call that the big three, you know, so we want to make sure, because those are all the things that we're supposed to be monitoring and helping families. Again, it's child health, child oral health, child development. As I talk a little bit more, we're going to talk a lot about early cognitive brain development. You're going to see lots of resources about early cognitive brain development. This is also how our incentive items are going to be provided to the parent, caregiver, and the EHS provider. We have, we were able to use some of our funding to purchase some incentive items that we're going to show and talk a little bit more about shortly. And data is going to be collected with the submitted reports and shared with the Department of Human Resources. Also, a part of this report to a referring provider, I've also included a survey, a parent survey. So you'll be able to get some feedback from the parents on their response to your work, the interaction, and if the materials were helpful to them in any way. Now, let's talk a little bit about billing. I just want to say what a great job the staff, y'all have done fantastic in the SSR billing, and I think a majority of you, 99% of you, have it down pat. We always bill the patient. We do not DPH, and so we want to make sure that we always bill the patient under the patient name. Sometimes I think what happens, let's say, for example, if you go to an EHS provider and you're talking about 2 or 3 kids and you're not sure how to bill that, all you've got to do is, let's say you spend 30 minutes with the provider, you just split that in half and you're billing 15 minutes to one child and 15 minutes to the other child. You go and you talk to your supervisor. You're not sure what to do with a case. You're not sure how to proceed. Very simple. And you're talking about 5 children and you spent 30 minutes. You can go ahead and break it all out and just divide it equally, or if you spent more time discussing one, you know, so you do have that ability to do that. You know, the main thing is we just want to make sure that you are billing the way it needs to be billed so everyone can be paid for their work. We do not code to DPH. Another piece, something that we've added, I know that when supervisors were reviewing cases or auditing the EHS file, there have been some questions, and so on how to bill that and that type thing, and so, but what we have come up with, and we tried to make it as easy as we could for the supervisors or for the social work director and manager. You'll go in, you'll create an SSR when you're actually auditing the EHS file, and then your note on the SSR form can be super simple. It can just be chart audit completed. And then in the information that I've sent you, or this PowerPoint, there's an example. You just need to indicate that you've completed the chart audit. Another piece that you can also do is, let's say you've reviewed some records, or there's some there's some question with, the family needing some additional services. And let's say that it looks like they need, an hour, 2 or 3 hours a month, and that's going to go over the 10 hours. Well, the worker could consult with you, and you could actually go in and review the record, and you see this file. There's a huge chart history in the chart room, and you could go in and just make you a note there in the notes section that you, in response to a consultation, that you've reviewed the record, and you just indicate the amount of time. And I do have a review, an auditing tool that will be sent to you guys for the supervisors. All right. So now let's talk a little bit about additional services to the Early Head Start curriculum that's provided by the ADPH care coordinators. The patient education models, like I said earlier, child health and well-being, child oral health, child development, and early cognitive brain development. We will be able to show you a picture of some of the resources. I'm not sure at what point, but we'll be able to see some of these resources as we're talking about them. The DHR education curriculum includes the protocol, which you all received last week. It's about 58 pages, I think, and has frequently asked questions. A guidance tool for the care coordination staff, and the professional resource material. This curriculum is about 600 pages long. So the professional resource materials, you will receive a PDF, a USB drive that has that information for you as well, and then you're going to get your 3-ring binder with the additional information that you'll be able to pull from and also be able to order materials. The EHS curriculum, let's just talk briefly about that. It includes patient education handouts, information on how to assess additional materials and incentive items to provide parents and caregivers, access to incentive items that help to promote overall positive child health and well-being. I'm doing this huge build-up about these incentive items because I'm just hoping everyone's going to be so excited about them because it's just been fantastic that we have been able to do this. They can be used with the parent and the caregiver for any child ages birth through 6 years. I'm pointing this out because we're using the Bright Futures materials. So let's say you're working with a family and they've got 2 or 3 other kids in the home. So some of the materials that you'll be receiving will be, you'll be able to use it with the siblings. You can create a schedule for reviewing the child health topics that's individualized and meets the child's needs at any developmental stage. Let me just talk a little bit more about this particular bullet point because I think it is so important that what we want to do with our patients is to be individualized. And this curriculum allows you can pick it up, and doesn't matter if the child is 1 or if the child is 3, you'll be able to go to the child dental section, for example, or the oral health section, and pull the information for a child who's 1 and for a child who's 3. And you'll have that, and you'll be able to just basically cycle it in and out, the materials, and there's enough material in this manual that you won't have to repeat any material. Because there's always a different resource. Yes, it's saying the same information, but there's always a different resource. All right, let's talk a little bit about child health and well-being. The care coordinator focuses on child health by assisting the family with establishing a medical home. One of the handouts for this meeting or for this training, there's a flyer that was about a medical home. The Bright Futures program, which we use as one of our resources for developing this curriculum, it actually has the newest information that's been released by the American Academy of Pediatrics, what a medical home is, educating the parent about that, about the importance of a child receiving comprehensive and preventative health care services.
I have a question about that. What if you go out to see a parent or caregiver and they don't know who their child's physician is and they don't know what to do or who to go to? What would you do?
Well, that's an excellent question, Carolyn. What you would do is, if they don't know who their physician is, you're going to find out, okay, do they have all kids? Do they have Medicaid? Do they have Blue Cross Blue Shield? You will have to have that information so you can figure out what's the best way to guide them. Naturally, if they've got Medicaid, what we're going to say is, okay, do they have an assigned physician? Then we're going to go and you can pull it up on the website if you want to, or you can actually say, well, let me go back to the office and I will get back with you on that, or you can contact Medicaid yourself. And there's information in the manual that actually has a list of all the approved providers and a flyer that you would be able to give the parent about how they can access that information. And you want to go one step further. Not only are you giving them a telephone number for Medicaid or a list of the providers, ones they can choose, because let's say they're not happy with their provider. They want to change because they've moved and their provider's all the way on the other side of town. So what you want to do is you just want to be able to, you want to link the family to the doctor's office, but you want to make sure, can they get to the appointment? You want to educate them about making sure that if they're not happy, there is a way to change your provider. And you want to stress the importance of the preventative health care services, and which is, really great that we've got some great information about stressing that. In the manual itself, we actually have some materials that you're going to prepare the parent for those child health and well-being appointments. And what I have found from talking to some pediatricians about this particular educational material is that they want care coordinators' help in preparing these parents for when they come to the doctor. So for example, we've got in this manual questions to ask the doctor. So you're getting ready for a doctor's visit. They're having their 4-month checkup, 4-month well-child checkup. Well, there's a section there that you'll be able to, what kind of questions do they have about 4 months when their child's turning 4 months old? Why do they have to go? Well, you've got information in this manual that's going to guide you through and give you all of those answers and handouts that you'll be able to share with the parent at the same time, and then you'll be able to leave that with her. And, some families, it may be that you may need to call the doctor's office. You might even have to meet them at the doctor's office. It just kind of depends on the situation. So that, I just think is that having that, if they're Medicaid, you all know what to do with Medicaid. If they're all kids, if you're not sure, you can always call the All Kids Customer Service line about what to do in regard to an assigned physician. We have, there's a list of approved providers of information about all kids providers. Now, if they're Blue Cross and it's their work insurance, you're going to probably want to encourage them to check with their insurance carrier and find out, do they have to, can they go to anyone, or if there's a particular physician or pediatrician in the area, then just call that office. Are they accepting new patients, and do they accept that particular kind of insurance? The child health materials include their educational materials that are a variety of sources, and if any of you all, I'm sure you all have heard at various trainings, the term evidence-based. Everything is evidence-based. That's one of the reasons why we're choosing some materials from the American Academy of Pediatrics, the Bright Futures program, the Centers for Disease Control with CDC, and healthychildren.org. I would encourage you to go to each one of these sites and check out some of the great information. This guide, this education curriculum, is jam-packed with information from each of these sites that you'll be able to use and actually share handouts with the parents. And, the CDC, for example, they've got some great information about child development and children achieving their developmental milestones timely, and teaches parents what to watch for, as well as, any other caregiver. It may be that, let's say that the provider's got some concerns because she's picking up on that the child may have some developmental delays, and maybe you decide to go over to the Early Head Start site and observe the child. And then you can go over and observe the child and set up a time to meet with the mom So then y'all can talk, or the dad or the caregiver, and so y'all can talk about some of these things that you've observed, not to alarm the mother, but just to help prepare the parent, father, the grandmother, whoever, for when they go to that well-child appointment. Some topics under the child health materials that are included, you know, I'll be honest with you, what is a medical home? When people started throwing that term around, I just really wasn't quite sure what that meant. And, you know, okay, medical home, I was not as savvy in the very beginning when they started throwing that medical home out, that term. So it's a patient family-centered home where they receive health services. There's some great information, again, in the in patient education material in this manual that you'll be able to use that educates the parent or the caregiver about what to expect from the doctor's office. And the doctor's offices, they are all trying to, I guess, get on the same page about this patient-centered medical home. So I'm seeing where I've been reading articles about how pediatricians are implementing advisory committees, and they're including parents as a part of that advisory committee, so they're making sure that they're getting that parent input about what works and what doesn't work. The child health materials also include well-child visits. And the frequency, what's going to be discussed at the well-child visit. The early periodic screening, the EPSDT, how to talk with the doctor. That's some information that will be in the material that you receive. Also, we will be discussing more specifically at the face-to-face training in August that we will have someone who is an ambassador from the CDC who will be coming and talking about these materials as well. Child oral health. The care coordinator focuses on child oral health by helping the parent to identify a dental home by the age of 12 months, assisting with scheduling 2 preventative dental visits per year if needed, and using appointment reminders and monitoring appointment compliance. I'm going to just take a second to show you one item that I think is very cool. This is Pony brushes his teeth. He is he's a great little, he's a hard board book. But for any child who, when, let's say mom identifies there's a dental home, they've selected Dr. Smith. Well, and they've made an appointment with Dr. Smith. So when you find this information out, then you get to award the child, the mom, with Pony brushes his teeth. All right, then you have this fantastic material about how to structure your child's nighttime routine. So let's say you're talking about child oral health and the importance of that dental home. And they need to have 2 preventative dental visits per year. And so what we've done is basically we've got some other books that you'll be able to choose from. So when it's time for them to have that preventative visit and they schedule it, they attend it, then you get to award the child a book. This is one of the reasons why we have partnered with Reach Out and Read, because we know reading is so important in developing that early cognitive brain development. So we want to make sure that we are putting as many books in front of this child and parent as we can. So just to encourage, that helps to encourage attachment. It helps to encourage just overall good child development. And we've got some tips that are listed in the materials about parenting and around teaching parents how to read to their children and using facial expressions. And we want to use appointment reminders and monitoring appointments and compliance. Another thing that we're going to be doing is you're going to educate parents on practicing good oral hygiene habits, which that is the Brush Book Bed program, which most all of you have received example flyers of what the Brush Book Bed program and what this actual, how to structure your child's nighttime routine. This is a handout that you will be able to give the parent, And you're talking to them about establishing good oral hygiene. Like, what's the schedule? What do they do? When do they brush their teeth? For infants, you know, they've got 2 little teeth, and they, you know, how are you supposed to brush those? Well, we have training that we're going to talk about when your child needs that toothbrush. When do they do fluoride? When do they, you know, that type thing. That information is in the manual. You will also be taking the child an oral hygiene kit. That goes to the child, and another cool thing is not only does the child get an oral hygiene kit, but every household member gets an oral hygiene kit. Your job is to give the kit to every household member, parents, adults, anybody living in the household. Just make sure that you document how many kits you give the family, because that's information that the Office of Oral Health has requested from us. We just want to make sure that we are pulling that data down. And we want to, you know, we've got some information on how to develop routines for practicing good oral hygiene for all children in the household. We've got some really cool stuff. It's like a dental chart. You know, as children get older, 3 or 4, then you'll be able to provide other incentive items that will be more age appropriate. So if you'll just keep that in mind as you're looking at that material. The education materials for oral health include Bright Futures, American Academy of Pediatrics, Centers for Disease Control, and healthychildren.org. If you will, sometime you need to just take a few minutes and check out the websites for each of these organizations, because they have some great material, and they have some free material that you can request. Some of the books, I know that we had sent some books out to you guys to just show you as an example. Where is Bear is one of the books. That's a book from the CDC, which is totally free. You can request up to 25 of those books. And right now, though, unfortunately, they have stopped printing because they've run out of printing money. But we have come up with another solution, so you will be receiving enough books for everybody. And the cool thing about Where's Bear, for example, or Amazing Me, It's Great to Be 3, that book, the cool thing about that is in each one of those books, there is some developmental milestone education that is listed. So as the parent is reading the book itself, you know, just take a minute and flip through it, and you'll see over in the corner or somewhere on that page, there's information for the parent as well.
Melissa, I think this might be a good place to take a break, since we've talked about those educational materials.
Okay, all right, that sounds good.
Do we have any questions? None at this time. Just remember that we do have opportunities for questions, so be thinking about those questions, and we will be back in 10 minutes.
Thank you so much. I hope we have everyone back with us. And we will be talking just a little bit about the materials. Like I said, where we left off was the Brush Book Bed program. And I just want to mention this idea is not so foreign, because pediatricians are also speaking the same language and talking about the same material. So all we're doing is really reinforcing what the doctors or dentists are talking to their children, talking to the patients about. The BBB campaign is what I like to refer to it as. It stresses the importance of nighttime routines, and it focuses on improving the implementation of oral health services in the medical home. I want to stress also that, let's say the child doesn't have a dentist yet. and the child has Medicaid, we know that a child can receive fluoride varnishing from a pediatrician, and so you're able to address the, oral health issues are addressed in the pediatrician's office up until the age of 3, or age of 2, I believe. So that's just something to keep in mind. The parent may say, no, we're not ready to go to a dentist yet because we are seeing the pediatrician, or we're getting oral health services such as the fluoride varnish through the doctor's office. When at the child development appointments, we know that the doctor is looking at the mouth as well because they have been trained to be aware of observe what's going on in regard to the child's oral health early in life. This program, the Brush Book Bed program, it links oral health information messages about early literacy and sleep. It's very important to get sleep. Sometimes I don't get enough sleep, and I'm not good at work, but it is very important that we all get enough sleep, and we just want to make sure that we get that message out. And as I pointed out a while ago, you have this Brush Book Bed. You'll be at our upcoming training. You will receive multiple copies of this, and you will learn more about ordering materials. This Brush Book Bed material, I tell you, is not limited to Early Head Start clients. It can be used for any of your patients that you may be working with, any referral type. So, because this is a service of the Office of Oral Health and Family Health Services, so you would be able to receive these materials for free, and so if you wanted additional copies sent to you to provide to your other clients, all you got to do is shoot us an email, and we'll send it to you. Here is just another little, we've come up with some kind of fun things that you can do, magnets and things like that you'll be able to provide parents. Why healthy teeth are happy teeth. This is a great chart that you will be able to, it's a cardstock type chart you will be able to show and give the parent, and it's got really cool graphics on it. We've also come up with a static cling type toothbrush chart thing that you'll be able to, the child or the parent will be able to check off that the child brushed their teeth twice a day. Again, it's getting in that routine. It's a reminder to parents, because parents, like everybody else, we all get super busy. We're worried about where we're supposed to be and where the children are supposed to be, and we're getting all this stuff done, and we've got to cook supper. So we're just trying to have as many reminders, put as many reminders out there for the families to just remind them about the importance of flossing and having those dental visits. And again, this is also some information that you'll be able to use not only for the EHS child, some information that will hopefully be passed on to the siblings as well, because what we know is that if we're teaching our parents of the importance of a child having 2 preventative dental visits, most of the time we're going to see that not only does your child, the EHS child, get a dental home and go to the dentist, but so do all the other siblings. And I just think that because not only, we're going to be able to help the most children when we think about when we're going into a home or we're working with a parent, think about the whole family system, as social workers always do, and use these materials to educate across the board every family. Also in the materials, you'll see there's a list of indigent dental providers. We have many Alabamians who don't have dental insurance. And so we've given you resources that you don't have to go search out on the internet. We've actually already put that information in there. It's a time-saving thing. That's what, when I put the information in there, you've got a list of all the dental providers who provide the underserved or the uninsured, who will provide services at a sliding fee or at no cost. That information, and we will just print you a copy out of that and take that to the parent as well. Again, another piece of helpful information that you can also add to the psychosocial assessment. You would want to include that information that the parent doesn't have dental insurance. So when you are talking about oral health, you will remember that you need to also make sure that they have a provider list. That's one of those things that you're not going to make a monthly you're not going to make a face-to-face contact, but you can this particular month. But you could actually go ahead and print out that list of the indigent providers for dental care and put that in the mail to them. Yes, it's not necessarily for that EHS child, but again, you're helping the parent to help the child that helps the child in the long run. So that's just, we've tried to include professional resources for you that are going to be helpful, and so you don't have to search for them. We're going to also be focusing on child development and early cognitive brain development. We've got some information from the American Academy of Pediatrics, the Bright Futures materials, the Centers for Disease Control, Know the Signs, Act Early, which is the developmental milestone piece. I encourage you to go to the CDC's website and look at their great information. We have an ambassador, like I said, from the CDC who will be training us on how to actually use some of these materials. There's a section under the child health section of this material in which Know the Signs actually comes with, it's this laminated chart type thing where you would be able to go through by the child's age and pick out, let's say the child is 6 months old. We've got one that's for 6 months old, and you'll be able to go through this list and, okay, Mom, and you'll actually be able to go through it and see, is this child doing everything that she needs to do or should be doing by this age? Then you'll be able to turn around and give Mom a handout that's very simple and easy to read, and she'll be able to use that information in trying to decide, do I need to say something to the doctor? Should we wait till this next developmental visit or the next well child visit, or is it serious enough that we should go ahead and make an appointment before the scheduled appointment? Reading is so important. We're going to promote early cognitive brain development through reading, which is, we're working with the Reach Out and Read program. For those of you who are not familiar with the Reach Out and Read program, it is an organization that is a private nonprofit that was started, I think, best way to explain it is to help the pediatricians in educating and helping to promote early cognitive brain development. And so the Reach Out and Read program, they have been educating and linking physicians across the nation to reading materials that are best suited for children at certain ages, and trying to promote the concept of just giving parents that little extra push, that give them a book when they come in for their well child appointment, and encourage the parent. I heard this story not too long ago about a mom who, she was in the doctor's office. It was a well child appointment, and she was a woman not much didn't have a lot of money. She was making ends meet. She was kind of crumpled and dirty looking, but you could tell. I think I got the sense that maybe the patient's caregiver was not totally comfortable there, but the doctor was doing the best she could about making the parent, as comfortable as she could. She'd been, I think, maybe working outside in the garden or something. I don't know, but because the notice of that her hands were not real clean, apparently, and so the pediatrician is talking about how important it is to read to the child, and so the pediatrician, she gives this book to the mom, and she says, the prescription for today is, I want you to take this book and read it to your child every night before they go to bed. And that was like, what a cool prescription. You get a prescription for a book. And so the mom says, you mean I can have this? I can take it. Do I need to bring it back? And the doctor said, no, you don't have to bring it back. This is for you to have and to keep. And the woman said, I've never been given a brand new book before. And I thought to myself, oh my gosh, because we do have families that, yes, they use the library. We have so many families that are going online and doing things, doing screen time, but maybe the art of reading or just having that hardback book, you don't see it as much, or is it a necessary expense? Maybe the question that sometimes gets asked. And that story reminded me that sometimes other things are more important. Having food on the table, being able to pay the light bill, and just trying to figure out prioritizing. So I thought, and I think, we're trying to prioritize and help those families when they can't afford to buy books that, so our thought is, why not share books with the family as a way to help develop that child? And so that's what we're going to be doing, and we will be promoting the Reach Out and Read program. We've got tons of tips on the best way for parents to, recommendations on which books to choose from, how to do that. One of the things that I read not too long ago, it's a handout that's in the material, is you should use lots of facial expressions and actually just be very animated about your reading to the child. And then as the child develops and grows, then you'll start to see where that child is pointing and touching things and are going moo moo cow. And I'll tell you, the doctor's office, that's what they're looking for too, because when the child comes in for a well child appointment 9 months, 10 months down the road, or 2 years down the road, and the doctor hands the book to the mom or the dad, and they're looking at it, the doctor's going to expect that child, what does the child do with the book? The child starts chewing on it, depending on the age. If the child does, or open the book and the child's pointing at something, if the child doesn't do anything, what that does is tell the doctor that child's not been exposed to books. And so it's just so important that we remember that, and how important it is that we teach our children the importance of, teach our patients the importance of reading, so the caregivers will hopefully feel encouraged and maybe have a sense of being inspired by that. There are some great materials at the library and some different resources that you'll also be able to do. The other piece of around the early cognitive brain development and child development is the ASQ3, which this is not a requirement. Let me just tell you, you do not have to do the ASQ3. But the materials that you are receiving has the ASQ3s, or there's a PDF that will be sent to you. If you want to, what the ASQ3 does, for those, just a reminder to folks, is what it does is that it's actually a developmental screening that is super simple, and it's a parent-reported or parent-completed developmental screen. But in my opinion, and from my reading and research of this particular topic, we see the answers when they're more accurate is when someone is actually doing the ASQ3 with the parent. And so I would encourage you to look at some of that. If you're starting to think that there may be some developmental issues, you might want to pull out the ASQ3. Again, I'm not saying it's a requirement. It's just a resource there for you. You may say to the parent, I'm going to have the doctor, when you go in for the next appointment, I'm going to give them a call and just let them know we've got some concern around the child's developmental history. And so maybe they might decide to do the ASQ3 there at the doctor's office. All right, and there's some incentive items. I want to talk a little bit about these incentive items. We have a variety of patient education material that had been included in the manual for the care coordinator to review and provide the parent and caregiver of the EHS child. In the remainder of the manual that you'll receive, the 3-ring binder, the child health sections and the child development and early cognitive brain development, you're going to find all of that under the child health section. We're going to take this opportunity to just kind of show you some of the materials that are going to be used. That we have created this logo as part of our, you'll see this bus because we have lots of stickers that are going to be going on books that you'll receive at the workshop in August, and also be available through the Procure It system. And you'll see we've selected some materials that are, like there's a black and white book, so for infants. We've got board books, and of course we expect children to put these board books in their mouths. There's all kind of great books, and you'll see the rubber ducky, for example. That's one of those developmental tools that you'll be able to use. Can that child pick up that rubber ducky? Oral hygiene kits. You're going to see the stacking cups, ABCs all around me. You all received some of those. That's a flashcard type book in which, let's say the mom and dad, they're going to the doctor, or they got to take a long trip to grandma's house. Well, ABCs all around me is a fantastic way for the parent to maybe, if the parent's sitting in the back seat and the child's in the car seat, you're able to sit there and just go through beautiful butterfly. And just to flip through that book, there's one that is being printed for infants that's more just black and white. It's the same type of book. You see our stacking cups, and then there's a plate and some building blocks. So a lot of these items that you're seeing are items that will be used in our toddler development kit, which that's the duck. There's a duck and an elephant. You'll get to give all of these little items like the ball and the crayons. There's a few other little items that go in there. All that goes into the cup. All of that is going into the little ducky backpack. That once you see that the mom, dad, the family's committed to doing this and they're going to participate in the program, then it's like, okay, then you get to bring out the really cool stuff like the toddler development kit, because you get to give that to the parent. In our training in August, we're going to specifically talk about how to use this toddler development kit in a way that is going to teaching the parent about developmental stages and what they can do. There's information about the CDC, tracking the milestones that is also a part of that. But this toddler development kit, to me, was one of these, just a great thing for the child to be able to use. And again, we've got all these fantastic books that, you know, they come in sets. They come in, like we have one that's a set of 4, you know, and there is no prescripted time. You can, if something's going great with the case, for example, Mama's been doing great, getting to the well child visits appointments, and you hadn't had to do any reminders for her. She didn't like the dentist, and she found another one. You can just award books based upon just because the mom is being so responsive, or the dad, or the family system. These same materials, you will be able to also take these same materials. The provider gets a whole load of these materials. The same thing that you're giving the parents, the provider gets as well. This is going to hopefully open that door for the provider, where you're going to be able to take your load of materials over to the provider and say, hey, this is everything that we are giving any child who participates in our program, and they get to use it for their classroom. Hopefully, the goal is for the provider to then turn around and say to that mom, let's say mom's kind of on the fence. Does she really want to participate? Dad's on the fence. But hopefully, the providers say, you need to participate in this program because look at all this cool stuff your child's going to get. And that is our way of hopefully you'll be able to get in the door and stay a little bit longer in a sense, because we know that sometimes families are so busy, and it's about what are they going to get from it? Well, unfortunately, you know, that's just sometimes you have to be able to, you need to have something that you can actually share with the family that they will see as really, truly rewarding. And so hopefully some of these items will be things that they will see as have some value and helpful to them. Let's talk about reading, promoting early cognitive brain development. You know, I know I've talked about this. I've said several things about it. This is the parts of a parent reader, which I just thought was a really cool slide. And this is a handout that you'll be able to give the mom, dad, parent system, whoever you want to, and just share that information. You know, as you're talking to them about what's going on. The healthychildren.org have a list of books that are recommended for children at a certain age, from birth to age 6. We have included that information. We have books that have been purchased, are being purchased for children around certain like health visits, such as a dentist visit, or for a doctor's visit, a well child visit. Developmental milestones, so important. I do want to just mention another book that is really cool is I Love You Like Sunshine. This is a fantastic book, and at the training, everyone's going to receive a copy of this material, but this I Love You Like Sunshine is one of these books in which it is another one where it can be used any age child from birth to 4. It actually has in the margin tips for the parents. Again, it's one of those things that helps to remind the parent what to be watching for. It's just a fantastic book that we think, I know that Polly McClure from Reach Out and Read is going to be educating and using this material at our training coming up in August, and I think that everyone will enjoy that. ABC's All Around Me, you all received this. There are 2 other editions that will be coming out. One's a black and white edition, and another one will be edition that just is not the words will not be as difficult. But we wanted to make sure that, again, that you had this information and that you were sent extra copies of this information. So let's say if between now and August you're going to see a parent and you want to take them something. Well, this is one of those things that you would be able to share with them because you've received other copies. With the protocol, you have basically enough of the materials for you to be able to start using the protocol and begin, you've got to decide, okay, where are you and where you begin. Let's say your child is, okay, it's time, he doesn't have a dentist yet. That'd be one of the first places I'd start. I would think, just based on right now today, if I had a child who didn't have a dentist, that was on my caseload, I'd probably start there. And I'd look at, some of the materials that have been sent to you all. And you'll be receiving a PDF, or like I said, a jump drive that has this information as well, and the other additional materials that go along with it for your handouts. Here's just some information about tips for raising readers. I sent something out not too long ago about Dr. Dave Walsh, who is, I'm a big fan of his, and Erin Walsh is his daughter. And Dr. Walsh came and spoke here several years ago, and he just got such a good sense about, he's very realistic. And I don't know if you all have looked at his website before, but they have a great blog that is, it is perfectly fine for you to print. He's given permission for us to use his materials in this program. One thing that his blog points out is that it's important when you're raising readers, long before babies can read, you get started today. Talk. Talk with the baby a lot, even before she or he is able to speak, because children learn to speak by copying the language they hear. They need talkative role models. Read to your baby every day. Starting a tradition of reading right away makes it more likely to last through childhood. By reading to your child, they start associating reading with fun and togetherness. Some more tips. You want to keep the story short. Don't force your baby or your child to sit and listen to an entire book after they have lost interest. Read a few pages and the baby's lost interest, and then, come back to it later. Because again, it's just really in the very, as children, the younger children, again, it's just talk, and making those word associations. And you want to let your baby take the lead. He may prefer to read the same page over and over again, or flip the book over, chew on the pages. That's not a problem. Remember, the goal is to have fun, and board books can take a lot of wear and tear. That's why we're including so many board books, because they can take a lot of wear and tear. More tips. Don't shy away from poetry. Rhyming and rhythm are great for babies and children. Be a ham. Read with excitement and expression. Use different voices and sound effects. And don't hesitate to act out stories. I was trying a while ago, I said moo moo, cow, or meow. It's perfectly, that helps to get the child in line. Being silly is a part of, it's fun, it's part of parenting. And we know that child one day will start moo-mooing too, so. Editorialize. Books or babies don't have a lot of words. Feel free to embellish, expand, and relate the stories to real life, even if they aren't talking yet. There's a doggy in this picture. What does a doggy say? Woof, woof. Our doggy is black and white. Make it interactive. If you ask a baby a question, remember that any sound she makes is a great answer. All right, so we talked a lot about the materials, and there's more to come. But I want to just talk briefly about case closure. This is one of those questions I get a lot about case closure. Just remind everyone that these cases are they remain open for the length of time the child is enrolled in an early Head Start program that is participating in the grant. And let me remind you, we have, there is a new RFP that has been released, and they have made a decision. I do know that in Randolph County, their Peachtree is no longer, I think at the end of June, they are no longer going to be a part of the program. So this is an example. In Madison, you had this same issue that came up. You had a provider that no longer was participating, so you got to close all those cases out, and then you close the case out. The case needs to remain open as long as the caregiver accepts ADPH care coordination services. Again, I'm hoping that some of these materials that you're going to be able to provide the parents, that they will be more incentivized to use the materials. Remember, we follow these children from 6 weeks of age all the way through like 4.5. Because remember, if a child is at an early Head Start site that's in a family daycare home, then those children can actually be followed to 4.5. Now, I know that Randolph, we've been having some discussions about Randolph County recently. I did check with the Department of Human Resources and was reassured that anytime when we have situations that a provider is no longer going to be providing services, such as Peachtree, for example, they have a provider, it's TRC, that is going to step in and actually find some new or they have new provider homes or centers who are going to provide that service. So we will see some new additions to that list, hopefully in July, August, when that will happen. So just kind of be watching for that, and then you'll be able to then schedule your visits. And as soon as I have additional information on when the new providers, when you can actually begin contacting them, I will let you know. We still get the referrals the same way each month. That information is shared with us through the Department of Human Resources, and we will get that referral. And remember, August is coming up, and that's when we get that big batch of new referrals. So you'll want to make sure that's when all 566 come about. If you've closed some cases recently and you think, wait a minute, I need to go back to this mama and daddy and say, hey, well, let's talk about this again. I've talked with some counties about this. Let's talk about doing this program again. Let me show you some of the items, and can we do this again? Wait till August. If that child is still on the list and you tried to get them to buy into services, go back to them and use some of this information as a way to get them to buy into it. Again, and then work with that provider as well to get that provider to decide. And I have to show this. I've just been reminded that this is a doll. We have a little rag doll that is in the information or in the materials that she will be, every child will receive a rag doll. That will be a boy, a girl, and they will be of different races. And one of the trainings that next month that you're going to, from the CDC, they actually use this doll as a way to teach about developmental milestones. So you'll be able to, this is another little piece of just a doll that's so cute that the child will be able to have. And there'll be little developmental milestone reminders for the parent that you would go over with the child, with the parent, and then be able to remove those choking hazards and give the child the doll. All right. Do you have any questions? I know I've given you a lot of information.
Yes. The first question comes from Baldwin County, and their DHR Early Head Start provider is an in-home daycare. They have reached out to them by phone and email numerous times, but they've had no response from the provider. They're a little bit hesitant to do an unannounced home visit due to the fact that the daycare services are being provided in a private residence. Do you have any suggestions for establishing this relationship?
Yes. Auburn University, the folks who handle the homes, I would contact Auburn University, and I can share that information with you after this meeting. and you can contact them because they will actually make contact with that provider who's not being as receptive.
Okay. The second question comes from Mobile. Do you have any tips on how to reach out and engage parents since most of them are working moms? Case managers have found that they're very hard to reach. You mentioned that the centers are aware of the program, but their experience is that many of the EHS providers and parents are not aware of the program. And parents of one of the EHS have been referred to the program as the DHR program because we think the EHS has told them it's a DHR program. Do you think this may be a factor that causes parents to be unresponsive to our care coordinators reaching out?
All right. And repeat the first part of the question.
Okay. The first part, do you have any tips on how to reach out and engage parents?
Okay. Tips on reaching out and engaging parents. Well, again, I hope some of these materials will help you, but one of the trainings that we have on the agenda for the August session is engaging and joining with the parent, and we have a trainer who's already on the agenda to do it, and she's going to teach us some tips that we'll be able to do, and we can look at talking with DHR. If they're a home, sounds like to me there's a breakdown in communication between the Auburn University staff and the providers. And if they're a center, there's a supervisor or a manager, the grantee, that maybe if the grantee has not been contacted about some problems that they've been experiencing, then that would be a next step, which the grantee is listed on that list of providers, the actual contact information.
I can see where parents might not want to get involved when they get a call from the daycare center and say, hey, DHR would like to come see you, and wondering if they're being investigated, which of course they're not. So that may be where they need to educate their daycare centers about that. Yes.
And we would, well, I know when we first started doing this program, we were stressing the importance of, or we wanted it to be ADPH, and we were trying to exclude or not have the DHR part. We call it our DHR grant, but it not to be as big of a piece, where so parents would feel a little bit more comfortable. But we can talk with DHR about some suggestions that they might have. And, there's the question about because they work and, maybe talk with your supervisor around say if you're having trouble with a particular family or a few families or whatever, talk with the child care provider. Maybe set up an afternoon that you're going to go over around pickup time and educate both parents at the same time in a group setting. Just so you got two sets of parents and they're sitting there and you've got the daycare provider, and let me tell you about the program, or really hopefully what you could do is also Auburn University will help you to get in that door of that home that has not been responsive, and you set up a time to meet with them at Auburn University. They have a person who is assigned to them, and maybe they could meet you at the home as well, and then you'd be able to go through these materials with the provider. Now, you're going to have to do it at a time. This is where some flexibility and some talking with your supervisor. Let's say you normally get off at 4:30. Could you one day, work a little bit later and maybe flex your schedule? Just talk to your supervisor and see, because it may take something like that in order for this to happen. We just came back from a conference with Early Head Start, and there were 75 sets of parents there, and they were actually at Robert Trent Jones for a couple of days. The grant DHR actually paid for their stay, and these were very interested parents. They had all these great speakers around child development, and I know that's the cream of the crop in a sense, because you had these people who were there. They were invested in their child, and I'm not saying that these others are not invested. They just may not be as educated about all the services that we provide.
The second part of her question was, since parents of the EHS have referred to that program as being a DHR program, do you think that may be a factor and cause parents to be unresponsive to our care coordinators reaching out?
I do. I agree with Carolyn that yes, it does. And I think that that's something us working with DHR and us trying to focus on the care coordination piece and the well child development. This program is more than just reminding parents about doctor's visits. You know, it's about promoting prevention, promoting preventative care. It's about early childhood development. And the more that we can arm a parent or give them information and they see it as being helpful, then I think, you know, maybe hopefully they will not see us as the bad guy, you know, because I love the Department of Human Resources, and I hate it. They always get the short end of the stick because they're really there to do good work. But we'll talk with DHR about that.
Okay, the third part of her question was, previously the CHR3 was required. Is it not required anymore?
Yes, it is required. Thank you for pointing that out. Okay. All the releases that are required are the ones that you would normally do for any case, you know, where you're releasing and giving information. We are sharing information with the Alabama Department of Human Resources from the provider report. When you call the doctor, you want to be able to communicate enough material with the doctor about what's going on and asking some questions, and you want that doctor to be able to communicate with us. So it's very important that you do get those releases signed. I've given some example releases in the materials that you've received. I've previously provided that in the first training, but that information is there as well. I do also know that DHR has asked for some more specific information around well child visits, I believe. And so we're having to look at that area again, just to make sure that our release is covering what we need, because if we've got to provide them some more information, then we may have to go back and get legal's opinion and get a new release worded a certain way.
Okay. Is the next question, is there a contact person from EHS DHR program that a parent can talk to when they are skeptical of the validity of the program? They have a lot of parents who say they are not aware of the program. So is there somebody they can contact to talk to?
They can contact me, and I think probably what I can also do is I can talk with Carolyn. There may be some ways that we can help remedy this particular solution, and we can talk a little bit more about that in August.
I think part of that, too, is the provider. You know, when they're at these daycare centers and these Head Starts, the provider needs to be providing that validity too, because they've had other children in the program and they can share that experience. So I think they could have some responsibility in that as well.
And in July, I know DHR asked me last week or 2 weeks ago, Carolyn and I were at DHR, and they asked me about probably going over and doing that training again for the family daycare homes, in which and that I spoke to that group before, and that is probably going to be, I'm going to take some of these questions back that I'm getting now and go back and take these questions back and say, well, this is some of the feedback that I'm getting from staff, and so how can they help us? This is, you know, great information, and we'll get it, and we'll try to resolve some of the problem that way. That may be the best way for us to get a handle on the providers.
Don't have any more.
Okay. Maybe give it a couple more minutes, and with any more questions or no phone calls.
You can remind them that the training is August 22nd and where it is.
The training is August 22nd, and I sent out an email earlier today to one of the managers or one of the directors. It's August the 22nd, and it's at Alabama Public Library System, Monticello Road. Some of you may have been to training there. All of that, this information will be, you'll get a link to register, and it will be from 9 to 4. Continuing education is going to be offered, and we really hope that everyone will be able to attend. We are trying to, and I'm going to send more specific details out, I'm trying to pay for your mileage and hopefully cover your lunch so you won't have any kind of paperwork or per diem or anything like that.
Do you have one more question?
Oh, one more question.
Okay, will the kits regarding development be provided to the EHS providers or just to the parents/guardians?
Both. Well, they will be provided to the care coordinator. It will be up to you, care coordinator, to get the kits to the parent or to the EHS provider. The provider gets everything that the parent gets. It's just that the provider is going to get that information, going to get everything at one time, unless you decide it should be done differently. You can, it's your provider, it's your area. I'm not going to pretend to know what's going to work best for your particular area. But to me, it's, if you're trying to set up if you're trying to really develop that relationship with your EHS provider, I just think about for them to be able to use these materials, to put them in a box, set up an appointment, and go over there and show her everything, and then leave that with her. This is for her to use in her classroom, and she doesn't have to pay anything. The other piece of information that I forgot to mention around oral health is Jennifer Morris with the Office of Oral Health. Her information is listed in the protocol or in the additional guidance or something. Jennifer Morris is the person that you'll contact about if you're in need of oral hygiene kits, not only for EHS children, but for any other child or family member. So if you've got an event coming up, or you need oral hygiene kits because you're going to be seeing some families and you've got lots of siblings and you are running out, you want to email Jennifer Morris. This information you'll be reminded of this at the training in August. You'll also get to meet Jennifer. She'll be there because she's going to be doing some training on oral health and educating the parent about oral health needs. All right.
Any other questions? No. Well, this concludes our program for today. I want to thank Melissa for being here, and thank you for watching. As we close, a reminder for care coordinators working in the Early Head Start program: you must complete and pass the test in LCMS that is included in the packet of information regarding today's program as part of your required training. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.